Welcome back to the Perfectly Holistic podcast. I am Pam Mills, and I'm so excited to be back with you guys again today. And my friend Dr. Judy Jasek has agreed to come back and share more of her wisdom and knowledge from years of practice. And I love the fact, Dr. Judy, that you have an integrative, holistic mindset, which is amazing. And I think a lot of people are really being attracted to that because what they're doing may not be working like it may be used to, or maybe they're just tired of being on a hamster wheel and they're looking for alternatives and other ideas and further education to kind of broaden their holistic toolbox. One of the things that came up in our last discussion was talking about cats with kidney disease, and the common recommendation is switch your cat to a low protein diet. And I thought that's brilliant, because not a lot of integrative, holistic minded vets are even talking about this. And so I'm excited to dive in and get your thoughts and your wisdom to share with our listeners and viewers today. So thank you for being here.
You're welcome. It's my pleasure.
Yeah. So where should we start? I mean, it's a microcosm of a topic that you can go in so many different directions. So I'm going to hand it over to you.
So one thing I'd like to start with, and this is more of a general concept, but I think it's really important. I think the big paradigm shift that needs to happen for both pet parents and veterinarians is that number one, we recognize that health is the natural state of the body. The body is made perfect. It's not made flawed. We don't create health. We can do things to support it, but the body is perfect by design. And I think we have to start by recognizing that. And then our approach needs to be looking at the animal, not just the lab work. Conventional medicine has gotten so mechanized, and it's going to get so much worse with AI. I am so animately against AI in medicine. It can be a useful tool for certain things, but for diagnosis, I believe practitioners as healers need to be using their God-given talents, their intuition, their hands-on. What are they getting from, it's that energetic piece.
Yeah.
And I'm sorry, AI is ever going to do that, give you a list of diagnoses, and I don't trust that it's not being programmed to sell certain products and certain diets and all of that stuff. So I think we always have to remember that we're treating the patient, not the lab values, and this is really important on this kidney issue in cats, because there's, stages, and I don't even know what they are because I don't pay attention to them, but they'll be like stage 1, stage 2, stage 3. So based on where the kidney values are, the BUN and creatinine, and they scare people, right?
Yes.
Staging is scary. They use it in cancer. People hear stage 2 kidney disease. Oh my gosh, I'll do anything. Just tell me what to do. So remember that medicine, I don't really want to say it's designed to scare you, but it does scare you, and they convince you to do things through fear.
Absolutely.
So as soon as you're afraid of something, if you're going to make a decision on a therapeutic for your kitty that's based in fear, take a step back. Nothing's going to happen if you wait 24 hours. Go for a walk, take some deep breaths, just get yourself calm, because when you're in that fear state, that fight or flight, you can't think clearly. Nobody can. We lose all of our logic.
Absolutely.
And I've had so many people say, man, I just wish I hadn't done what I did. I was just scared and in the moment. So I think that's another important concept. It's always okay to take a step back, take some deep breaths, and just, okay, does this make sense? So when it comes to diet for cats that, have an elevation in these values in the blood work. Now, I would say that the BUN, which is the blood urea nitrogen, and the creatinine are probably the two main standbys. I've been looking at those my whole career, so for 40 years, and they do correlate with clinical presentation, meaning if those go above a certain level, we'll start to see decline.
Fine.
But I see many pets, especially older kitties, those values go up a bit and they're fine. Their kidneys aren't 2, their kidneys are 16. So they're not going to work as well as they did. Oh, there's your co-host.
Yeah, she is my co-host today. Are you gonna hang out with her? Are you gonna learn about kidney disease?
She's got something to say. She says, I'd like to make a
She's always got
contribution.
something to say.
You
One of
Siamese,
those
yeah.
cats you could talk to all day just with We have conversations, don't we? Sorry.
Aw, just mama.
She's
Mama
cute.
girl. So let's see now. Where was I? Got
The
distracted.
diet, yeah.
Yeah. So the blood value. So there's newer values out there. And this is a little more on the technical side, like SDMA, that
Yeah.
I don't see that as correlating with what's really going on clinically in cats and their kidney function. Meaning I will see that sometimes elevated and the other values are normal and the cat's perfectly fine. And they'll still say your cat has stage 1 kidney disease. So I don't go by that. I go by the tried and true, that I trust my experience way more than I'm going to trust any newfangled test that comes out.
Yeah.
Because I've been looking at those values for a long time. So there are levels. If the BUN say is over 100, that's pretty high. That could be, okay, we're getting into maybe some end stage stuff, or our kidneys are really starting to decline. I'm working with a dog. It's a canine patient, and I just talked to them today. And this dog's BUN is 130. So you'd expect some pretty big symptoms, this dog. And they told me, because our original call was this very topic, diet. And they're like, the same question, because the same holds true in dogs. They recommended the low protein diets and all that. And they're like, we followed your recommendations. And now our dog is wanting to jump in the pool and swim, and it's tugging us to go for longer walks. And this dog is like 14 too,
Wow.
So, and the values are still up there. Values didn't come down. That would be nice to see, but the dog is feeling so much better. So what did we do? We got it on a species appropriate diet. So how does it make any sense that cats are obligate carnivores? They need to eat a meat-based diet. They should not be eating carbs. I mean, you'll see kitties will eat a few greens here and there. I think that kind of can sometimes help them purge, can provide a little fodder for the microbiome, for the bacteria in the gut. But for the most part, they need to be eating a meat-based diet. So how does it make sense then to switch them to a diet that's like, and I haven't looked at the ingredients in these diets in a long time, but it'll be like rice protein and soy protein. So they're not even meat proteins to begin with. And then they restrict them. And their logic is, well, the kidneys have to work to process protein. So the lower we make the protein, that it'll take some work off of the kidneys. That's their logic. But it's such an inappropriate protein that they're not even getting a good nutritional foundation. They need the right nutrition to have healthy kidneys in the first place.
Right.
So you're depriving them of any of their vital nutrients that cats need as carnivores. I don't ever take cats off of a meat-based diet. Now, another important point, and I hear this all the time. Well, these diets. So the typical kind of diet we recommend is like a raw blend. So it's your meat bone blend. You can do some like freeze-dried products for convenience here and there, but I think fresh is better, and you always want to be sure to reconstitute them, that they're getting the adequate amount of moisture in with the food, reconstituting it back to its normal moisture level. But a reconstituted meat-based diet like that will run about, people say, well, it's 100% protein because it's all meat. They're 12 to 15% protein. They're not high protein diets, and they're a species appropriate protein. So I don't change my diet. My diet recommendations for a healthy 1-year-old cat is going to be the same for a 15-year-old cat that these kidney values are starting to, creep up a little bit, because they need the same nutrition to be healthy. How does it make sense to take an animal who has an organ system it's maybe not working quite as well as it did when they were young, and then we deprive them of the basic nutrition that they need?
Yeah.
You know, when you think
Yep.
about it, it really doesn't make any sense. And especially the dry foods. I mean, to have a kibble type diet and label it a kidney diet, I mean, that's just
That makes sense
total,
to me.
total insanity, because
Yeah.
I think that's the other thing that happens with kitties. And I think it might be why, or at least one of the reasons why kitties do tend to be pretty prone to kidney issues. I mean, it is probably the system that tends to go out in kitties as they age. The kidneys go out first. And I think part of that is because cats are not by nature big water drinkers. They're not, they'll go to the bowl and drink, or they'll drink out of the fountain, but they're really designed to get their moisture from their food.
Yeah.
So for cats that have had like a kibble diet for even like part of their life, they've been in a state of chronic dehydration, and
Yeah.
that can damage the kidneys. So having that adequate moisture content in the food, and then doing the meat-based diet, I mean, that's what I've been recommending that for decades. And you know, I see animals with these elevated blood levels that do like what this little dog is doing, that, you know, I was telling you about. They do fine. They have a good quality of life, and they go along really well until they don't. And
Right.
what I have found with this approach is it really improves their quality of life, and they do really well. We still know. So when we're talking these really high levels, not just the little bit of elevation, but these really high
Sure.
levels, they'll go along really, really well. And then they'll have a couple of days of just decline, and, you know, then that'll be it. But these are usually, you know, like kitties in their upper teens, you know,
Yeah.
they're at their natural life expectancy. Fluids really help. So that's the one thing therapeutically that I would say
Mhm.
is giving those sub-Q fluids at home. That really keeps pets going, because no matter what they do or what you're feeding, the kidneys are not functioning quite up to par. They're going to be at least marginally dehydrated. So giving those, yes, you got to stick your kitty, but giving them those fluids at home really, really, I think, improves their quality of life.
No, I agree. And I'm going to go back to something you said in the very beginning, and that is treating the cat, not the numbers, not the lab work. And I had a vet tell me that years ago, and I thought that was wise advice, because every cat is different,
Yeah.
like you were describing the dog. So, you know, his normal might be a little elevated, but look at his quality of life, and he's good, you know, and he's happy, and he's more energetic, and all the things. And so we can't just put everybody in a box based on the numbers and the stage of kidney disease. I've even had clients tell me that their vet calls it kidney failure to help scare them. Like, you're stage 1 kidney failure, and they're just like, they're freaking out. And you know, I've mentioned the story many times on the air before. I had a kitty who had developed bladder infections that we didn't know about, because you know how good they are at hiding things, that led into kidney infection, and she was hospitalized, lost like a significant percentage of kidney function from it. Happened on 2 separate occasions, but she was left with about, they estimated, about 25% kidney function, and they wanted to restrict her protein. I was just like, well, that doesn't make sense. But instead of giving her the veterinary food, you know, which she refused to eat anyway, I gave her the really good, high quality. She was eating a canned food diet at the time. She was one of these holdout cats, like, I don't know if I want that raw stuff. You know, but she was already like probably 8 or 9. So, you know, she was.
It's hard to get them to do something new sometimes.
Yeah, it's like, it has to be their idea.
Totally. Yes.
So, she was on a high quality food grade, you know, diet, good brand, high moisture, and targeted supplementation. And she lasted 8 years.
Yeah.
And she never lost muscle mass. And let's talk about that, because I know that a lot of cats who go into these kidney diseases, they tend to have a lot of muscle wasting. Can you talk about that a little bit? It ties into your diet.
Oh, absolutely. I mean, if you're restricting protein, you're going to get muscle wasting, because what's the body going to do? The
Mm-hmm.
body's going to break down muscle to get the protein that it needs. I mean,
Yeah.
the protein that a cat is eating in a food, or if they catch a mouse or a bird, that's muscle meat. I mean,
Mm-hmm.
that's muscle meat. That's what they're eating. So
Yeah.
if the body isn't getting an appropriate amount of that, it's going to start to break down its own muscle.
Right.
And that's what happens, because it needs those nutrients, and the body is, starting to get in survival mode. And older kitties, like once they get into their teens, they'll tend to lose a bit of muscle mass, kind of anyway, just due to age. I think part of that is they're not as active, they're not moving
Mm-hmm.
around, they're sleeping a lot more, older kitties,
Mm-hmm.
20 hours a day or something. So they're not using their muscles as much. So they will lose some muscle tone and muscle mass. But yeah, diet is a huge part of that. So it makes perfect sense to me that if you put your cat on a low protein and inappropriate protein that those
Yeah.
muscles really can't even utilize, of course they're going to lose muscle mass.
Absolutely. Um, the other thing that always that I have learned that really makes a lot of sense, the fact that if it's really good, highly digestible protein. In other words, protein, a form of protein that the body recognizes and it can say,
Mm-hmm.
oh, I can utilize this. I can metabolize this. I can break it down. I can use it as energy. Versus, like you were saying, the plant proteins they put in these foods that leave me scratching my head and like, where's that? Doesn't make any sense whatsoever because they can't use plant protein. They don't metabolize plant protein. So of course, I don't even know where the logic is in that.
There is no logic, and they intentionally, I think they intentionally don't train veterinarians in nutrition. So
Of
they don't
course.
know any different. They just say, well, look, there's these great companies that have got this nutrition stuff all figured out. So you don't have to waste your time learning any nutrition. You just, use the food that they recommend. And I remember having a book like from Hills that had all the letters, they got A, D, C, D,
Yes.
E. They probably got the whole alphabet by now.
Yeah.
And
Yeah.
they just had little tabs, and you just went to the system of the body that was the problem, and picked the appropriate letter, and that's what they wanted you to do. And then you read the ingredients and you look at the food and like, how can this be healthy
Right.
for a carnivore? And a lot of that stuff is just industry waste. Really what that pet food industry is it's a dumping ground for industry waste. They don't, for soybeans are processed into, other things. I learned recently that soybeans are actually processed into diesel fuel. So there's going to
Mm.
be waste from every process. Corn is processed into ethanol,
Yeah.
and wheat, and all of these grains are processed into other things. So they just take the waste stuff and put it in pet food. And then the ingredients are so pure, they literally like spray the multivitamin on. Literally used to call it the magic sauce, just
Mm-hmm.
so it looks really great on the label because you got all these vitamins and minerals and all that. Well, it must be healthy because look at all these nutrients. But
Yeah.
those are all synthetic. So you're just giving a bunch of chemicals and you have no idea. You're talking about protein being bioavailable. You have no idea if those nutrients are bioavailable to the cat. So it's a complete false sense of security. Honestly, I'm surprised animals live as long as they do on these diets. I mean,
Well,
because there are
yeah.
people that say, I fed my cat kibble diet for 15 years and, it did fine. Well, good for you, but your cat would have had a much better quality of life. It
Well,
had a better protein.
yes. Yes, exactly. And I think, one of the things that is a disservice to the cat parent is they tell these parents that your cat has to stay on this feed the rest of its life. And prescription diets are not meant to be used for a lifetime. Maybe there is a therapeutic for a specific condition for, illness or whatever for a few days of, weeks or whatever, but not a lifetime. Because then you are looking at nutritional deficiencies over time because they have to cut something out because they're trying to put a band-aid on a problem. So, there's that issue. So then pet parents are afraid to even make a switch. And they think that their cat is doing well, like you just described. But I tell people all the time, if you had x-ray vision and can peek under the hood, so to speak, your cat's probably not doing as well as you think they are. They're not thriving. You know, their skin condition isn't great. Their eyes aren't great. Maybe their poop isn't great. Maybe they have digestive upsets and you just kind of push that aside as normal when it's really not normal. When you put a cat that's on, you know, processed food diets for their lifetime next to a cat that's been on raw or fresh food for many years, the distinction is drastic.
It's
side by side.
It's huge. It's huge. And a lot of people don't, realize that sometimes until they make the switch. They're like, wow, like, yeah, like I was telling you about this little dog. Yeah, the lab values are still up, but the dog's wanting to jump in the pool again and go swimming. It hasn't done that, So they feel the energy. The body is going to take whatever nutrients it has just to keep the vital organs functioning. So that's why you see decline in like the skin and hair coat, because it's not a vital organ. Body's like, okay, we can lose all our hair, but we need to keep the heart and the liver working, so it's going to take what nutrition it has to keep those organs working. It's going to use the body's own muscle, to get that protein. Another point I wanted to make is there is absolutely nothing prescription about any prescription diet. If you read the ingredients, the only thing that makes them prescription is that the vet sells them for more money than you could buy them in the grocery store. If you actually read the ingredients, you could probably go to the grocery store and buy something similar if you're going to feed that type of food,
Yeah.
The ingredients nutritionally, they're the same, and they're mostly carbohydrate. And this is, cats are so prone to type 2 diabetes when they eat all these carbs, and they'll eat these foods. Sometimes some cats won't. Some cats are like, no, not eating this stuff. This is crap. But some cats will get addicted to it because of the carbs. They're getting a sugar spike. And it doesn't matter whether it's soy or wheat or corn or whatever grain, whatever carb they're putting in there, it breaks down into sugar in the body and is causing a sugar spike. And they get addicted to it because it's not their natural food. They're not supposed to be eating sugar. They're supposed to be eating meat, which keeps their blood sugar stable. Yes. So cats will get kind of hooked. That's what makes it hard, I think, sometimes to transition cats off of a dry food diet or even a wet diet that has carbohydrates. Because some canned foods, and I agree, like if a cat won't eat raw, some of them just are a little just hard to transition. If they've eaten other foods for a good part of their life, they're like, no, like you said, it's got to be their idea. So going with a better quality canned food would be, not as good, but still better than a kibble diet.
Yeah.
But any of those diets that have that high carbohydrate that's spiking their blood sugar, they are getting addicted to it. And that makes it really hard sometimes to get them off of it. So I tell people, people always like to leave kibble out to let their cats nibble, because they like to nibble because they get cranky if they don't have something to nibble on. Why? Because they need their sugar fix, because they eat, it's like eating a donut. Your blood sugar spikes up and then it crashes. You get another little nibble of something sweet and it spikes up and it crashes. And I've heard lots of people say, my cat can't stand it if it can see the bottom of its food bowl, because where am I going to get my next hit? It's literally an addiction. And so to transition cats off of that, you've got to remove the option of you can't just give them a little bit here and there, because they're going to hold out their hit. And it's not always easy, and they will get very cranky, and they will be bothering you in the middle of the night and all that stuff. But you're better off feeding them a little snack of a meat-based diet, or a little like goat's milk or something. A lot of cats will like always raw. If you're going to do any kind of dairy, always raw, but like a little raw goat's milk to fill their tummies. And then once they get on that meat-based diet, their blood sugar stabilizes. It's not spiking up. It's staying at a similar level. So then they're more satiated. They're not, they might still jump on the counters because they're cats, but they don't have that food urgency. They don't have as much food urgency.
No, I agree. And do you think that the chemical palatants that they spray on that dry food also contributes to that addiction? Because otherwise, let's face it, they probably wouldn't go select cardboard tasting food to eat if it didn't taste good. You know?
I'm sure they're putting flavors on. I would say the most like for like older cats that are ill, that are just don't have much appetite. They're just not wanting to eat. If the owner goes and buys a can of Friskies, they'll almost all eat it. I don't know what they put on it, and I don't think it's but they will eat it. They'll eat it. So yeah, they absolutely put some flavor. They have to do something.
They would have to.
Yeah.
Yeah.
And
sure.
Their research that these companies do, that's what it's going into. It's not going into making a more nutritionally balanced food. It's how can we make this really nutritionally void food good enough that the cats will eat it.
Mm-hmm. I agree 100%. I want to pivot on something, because one of the reasons that vets will tell their clients to put them on a low protein, and because you don't want to feed them bone and they need to reduce their phosphorus levels. Can you talk a little bit about that aspect of the whole diet issue when it comes to cats with kidney disease?
Mm-hmm. You mean like in the phosphorus in particular?
Yeah, because I know some people are afraid to feed their cats anything with bone, because it's higher. Is it higher in phosphorus? I don't know. I don't know the percentages of the ingredients. We'd have to have the ability to break down those labels a little bit. But talk about that, because I think that's probably. And what is your opinion on this? Is that more important to look at when it comes to cats with kidney disease? Is it really the phosphorus levels we should be focused on, or instead of the high protein levels?
So I think, first of all, on the blood work, I think when the phosphorus goes up, so it is worth looking at the phosphorus. I think like I said, the two key values I look at is BUN and creatinine. The phosphorus, when the phosphorus level goes up, so this is up outside of the lab normals. Again, cats have different normals than the lab normals. So if it's just slight, it's not as concerning. If it's a significant elevation, and this is just something I've observed over the years, that BUN and creatinine are really going up, that phosphorus is going to go up. And I will say I have seen that's the point where they start to act like they feel kind of crummy. They sit with that hangy head. They really don't want to do as much. They're not as crazy about eating. So that higher phosphorus seems to really make them feel kind of crummy. However, I think it's also important to not throw the baby out with the bathwater. And because if you're eliminating something like bone, yes, it has phosphorus in it, but it also has a whole host of other minerals in it. So where are they going to get those other minerals? Plus, things like calcium need to be taken into the body in the correct ratio to phosphorus. So, and I think this is where things get screwed up in commercial diets that have all these synthetics, because they get the ratios wrong. In nature, when you're feeding a whole food, they're going to be getting everything they need in the correct proportions. They're going to be getting them just the way they need them. So I always steer people away from restricting phosphorus in the diet, because then you're not going to feed meat or organs or anything. It's all got phosphorus in it. Again, you're throwing the baby out with the bathwater. I think when you do that, I think rotation is really important. So if, say, one protein maybe has a little more than another, and we always recommend this in general, that we're rotating around different proteins. You're not just feeding the same protein. So doing that rotation, but then I do, when the values go up, I do recommend a phosphate binder. They just feel better when we get that phosphorus level down. I don't recommend giving it preemptively. I mean, I see a lot of cats, put on it before the phosphorus level goes up.
Yes.
That isn't preventing a binder is not going to prevent, it might keep the level down, but the issue is the kidneys are no longer able to excrete it. So if you start that binder too early, I think these binders could also bind other nutrients. I mean, who's to say it's just binding phosphorus? It could be binding other minerals. When they get to the point where the phosphorus is high and they're really starting to feel crummy, it's a trade-off, right? Sometimes you just have to say, okay, to maintain quality of life, let's add in the phosphate binder and see what we notice. And again, we don't just say, okay, phosphorus is this level, let's give this much of the binder. We say, let's give the phosphate binder and see how our kidney feels. Do they have more energy? Do they feel better? then it's a worthwhile trade-off. They've got some newer ones out now that honestly I just don't have enough side-by-side experience to say one's better than another, but the traditional ones that we've used for years, it's aluminum hydroxide. So is aluminum healthy? Well, probably not, but if it helps your kitty feel better, and keeps that phosphorus level down, it's probably a worthwhile, trade-off. So we kind of have to do that balance, but at the same time, we're not compromising their nutrition by taking all these nutrients out that they need to be healthy. So we're doing the same diet and then just addressing that one nutrient, that phosphorus, that can make them feel pretty crummy. And in my experience, that phosphorus doesn't go up until things are pretty far advanced. It doesn't go up like early on as we start to see these kidney values. I mean, and I see a 16-year-old cat and like their BUN might be 40 or 50 and the creatinine's up a little bit, like that's normal. To me, that's just normal. So let's optimize our nutrition, optimize what we're doing. I do use herbs. So the other thing I use for support is there's some Chinese herbs. Romani is very, very supportive. On the Western herbal end, good old dandelion leaves. A dandelion leaf tincture is very kidney supportive. So you can use herbs that help stabilize kidney function. And I really feel like those work because I've seen pets where their kidney values are creeping up and then we get them on the herbs and the better diet and then they'll kind of stabilize. And for, we never know how long. Like we don't have a crystal ball, but I always encourage people to, stay in the moment. How's your kitty doing now? Is your kitty having a good day and a happy day? Then be grateful for that. And enjoy that. Don't sit and just worry about, the what ifs. Our time with our pets is so precious because we outlive them. So enjoy the time you have. And if your kitty's feeling good today, be grateful for that.
Absolutely. I think the timeline, people get focused on the future too much and worry about things they can't control. The reality is, like you said, we're dealing with genetics and there is going to be an end date when those kidneys just naturally wear out because they're organs. Every organ, at some point in our pets will wear out, whatever time, age, disease, whatever. You can't really, unless you can go create new organs, which I don't think we're there yet. There's, the goal is for them to be happy, gone,
Yeah, exactly.
And, like you said, they're doing great on if you're feeding them the right diet and they're maintaining their muscle mass and their energy is good and their mood is good, stay the course, support the kidneys with targeted herbs or supplements and things like that can help. And just, like you said, go along and stay in the moment, enjoy, be grateful that they're with you. And then don't get too concerned about things that you can't control, like how long your cat may have, because that is not in our control,
Right. Yeah. And remember too, your cat isn't sitting there worried about this. They're not reading the lab values. They can't figure out why mom is all of a sudden, or dad all of a sudden, like so worried and tense every time they're around them. Your animals pick up on that energy. And I think that affects their health dramatically. If you can be, of course, you're going to be sad if you get some news that, okay, maybe we're getting close to the decline for my kitty or something is going on.
Yeah.
But your cat isn't sitting around worried about that. They just want to live a happy life and they just want you to love them just the same and do all the same things. And you don't have to obsess over them and do all this. I mean, I've seen so many people try to get so many supplements into them.
Yeah.
That's the big thing.
Yeah.
Don't over supplement. That becomes so stressful. You're gonna ruin your relationship with your kitty by always, I've had people tell me this. Yeah, every time my cat sees me now, it goes and runs and hides because it doesn't know. I mean, they're all day long. They're giving them something. So like you said before, have some targeted herbs that have been shown to have kidney support, and
Mm-hmm.
really watch the supplements. The supplement industry is a very, very big industry, and there's a lot of unethical products out there. You have to be really careful because a lot of them are also going to have a bunch of synthetic nutrients and just garbage in them.
Yeah.
So make sure if you're doing an herbal supplement, it's, it's a whole food supplement. It's designed to, do what it's supposed to be doing. It's from a reputable company. Really do your homework. Don't fall from the little, pop-ups online,
Yes.
2 a.m. for, remember, your internet is watching you. So as soon as you start searching for stuff,
Yeah.
disease in cats, what are you going to keep getting? You're going to keep getting a whole bunch of pop-ups for,
Yeah.
and companies are buying those ads, right? So
Yeah,
those are not the best supplements. They're the companies with the most money to put those ads up to get it right in your face. And you're like, sure, I'll buy it. Sure, I'll buy it. Sure, I'll buy
Yeah.
it. So you have to be really, really, really careful and just, get some guidance, when you're worried about your pet. It's hard. It's hard to, like I was saying before, sometimes make good logical decisions. So find a trusted herbalist or energy worker or somebody that can look at your pet a little more objectively than you can, because we can't look at our pets objectively. I mean, I can't even. Like, it's very hard if one of my pets is sick, like, oh my gosh, what do I do? Like, I literally tell myself, okay, this was one of your clients. What would you tell them? Because you're just like, you just kind of freak out, even if it's something minor, just don't handle our pets being ill or injured in any way. So just having that objective viewpoint, somebody that can take a look, use some common sense, and help give you some guidance on some good quality natural remedies, and be careful about, the Facebook groups and all that too. There's a lot of bots out there, just really.
Yes. And not only that, is they're just giving their opinions in a lot of cases, but it doesn't mean that it's going to work for your cat.
Right. It might have worked for their cat, and that's great. It's great that they're sharing, but it doesn't mean that it's going to help, it's going to help your cat. And you really just need some guidance in like the big picture, and like, okay, what are the most important things to support the kidneys? Okay, we start with nutrition. And a lot of times I think it's easy to just reach for the supplement. Well, let me just give them the thing that is going to help support the kidneys. And then maybe I don't need to worry so much about changing the diet. I always tell people, you change the diet first if they're not on a species appropriate diet. That's the most, if you did nothing else, do that piece. And then we can add in some extra support. And if you have to fight your cat to get the herbs in, then we don't do it, because it's not worth, every time you're fighting them to get something into them, whether they don't eat it in the food, it's more important that they eat. If we're trying to give a tincture or something and you're fighting them and they're like, doing the salivation and all that stuff, their body's now in sympathetic mode. It's in fight or flight. They're not going to heal there. So you're really doing more harm than good by fighting them every day. So focus on nutrition and the fluids are huge. I want to reemphasize that. If you can get fluids for home use, and this is giving the sub-Q fluids, so fluids underneath the skin, just back here under the scruff, can just make all the difference in the world. Because if a kitty where those kidney values are starting to creep up and they have a couple off days, which they will, and they get a little behind in their hydration, it's very hard for them to bounce back sometimes. It's much harder for them to catch back up. And so being able to give them those fluids, and sometimes early on, it's just once or twice a week. As things progress, it might be every day, at the end. But again, if it's a big fight and your cat just hates it, then you may need to rethink that too, and just allow them, and allow nature to take its course. They're not going to live forever, no matter what we're doing, sadly, as much as we would like them to. They don't.
Yeah. I do have a question about the fluids. Let's go back to that for a quick second. People would ask, well, at what point should I consider doing those? Is it a certain level of the creatinine or the BUN, or is it just their overall behavior or mood or not feeling well? or what is there like a window that you kind of look through or look for in order to start doing those?
So usually what I recommend is you get a dose of fluids. So if you don't have them at home, you probably have to go to the vet and just get some sub-Q fluids and see if they feel better. Again, we're looking at the pet. So do they feel better? Do they perk up when they get the fluids? And if you don't notice any difference, then they're probably good. They're probably maintaining hydration. But I would keep them on hand, like I said, for these downturns. Kitty vomits a couple times, little upset tummy, doesn't drink for a day. They're going to get behind in their hydration. Fluids are never a bad thing. They're never going to harm. If you're doing just like 100 mils under the skin, you can't overhydrate them or anything like that. But again, we're watching the pet. So it's a good thing to have on hand because it could save you a trip to the ER and all of that stress. If you're just like, kitty's having an off day and they're an older kitty, just give them the dose of fluid. Sometimes that's all they need. I've seen that so many times, just even treating pets myself. They just get kind of lethargic and down and you rehydrate them and boop, they're good to go. So
that's awesome.
If you can do that at home. So see how they feel after the fluids. And then as far as like how often do they have a decline? Is it like, okay, at day 3, after I give those fluids, they're starting to act a little tired again. So again, it's just observing. Some pets will get to the point where they need it every day, but a lot of them early on can do, twice a week. But if there's any elevation in those kidney values, boy, I'd have the supplies at home. Just see if your vet would give them to you, or
Yeah.
I don't know if you can get those on Amazon these days. You get a lot of stuff on Amazon. I probably wouldn't buy fluids on Amazon actually, because you don't know what's in them. But
right.
But think ahead is the point. Think ahead and just be prepared. That bag is sealed. It's going to last. Get an IV drip set and some needles. Well, go on YouTube. I'm sure there's 1,000 videos on how to give sub-Q fluids to your cats because it's just very, very common. And be a little bit prepared. And because the other thing is, so if your kitty has a bad couple of days and you're like, oh gosh, I'm worried about them, and you go into the ER, a lot of times all they need is hydration, and they'll probably do that, but they're also going to give them like 6 drugs. They're going to give them an appetite stimulant, anti-nausea. They'll probably give them antibiotics. They'll give them steroids. I'll give them steroids just because, they're going to give them all these drugs. Well, the kidneys have to work to metabolize all those drugs. So you're actually, in the long run, that trip is probably doing more harm than good because the body has now had to metabolize all those drugs. And all they really probably needed was the fluids. And you can also be strong. This is your kitty. You get to make the decision on their care. And if they're just having a bad day, you just go in and like have them rule out anything life-threatening, an intestinal blockage or something that is really super serious, like that could be surgical or something like that. They rule out anything life-threatening and say, I just want you to hydrate my kitty, no other drugs, and I'm going to take it home and we're going to see what happens over the next 24 hours. And then if kitty's still not doing well, I'll bring him back and we can go from there. And they won't like it because, they want to call the shots and they don't like when you come in and tell them what to do. But you have to advocate for your pets because I see so many, I've seen pets just like in the human system. The pets get in there, they go in and they start medicating them and they just get sicker and sicker and sicker. And I really feel like they're being killed by the system because one medication causes these side effects, then they get more medications and they're back and forth to the vet or to the ER all the time, more and more and more drugs. And I think it's those drugs that can really do them in. So, just remember that about the hydration. It's super important, and just be prepared because when in the moment you're going to be scared and you're going to be like, just do whatever you think is best. Because I think a lot of people have become conditioned. I think this is intentional by the system. They become conditioned to hand over the care of their pets to the veterinarian. It's like we're supposed to hand over our healthcare to, human physicians.
Mm-hmm.
Just do what you need to do. Just believe the doctor because they're going to do best.
Yeah.
That's not the case these days.
No.
And I'm not saying that the veterinarians are necessarily bad or malicious. It's the system. It's profit driven, and they're being trained in such a way to use these medications, sell more diagnostic testing, to do things that are not necessarily in the best interest of your cat. And trust your gut too. If you're like, oh boy, I don't know for sure, I'm not a doctor, but that just doesn't feel right, then you don't do it, because you know your pet better than anybody. Yeah. And you have to be prepared, be strong, practice it in front of the mirror when you're not stressed, whatever you have to do. But you've got to be strong and be prepared for some pushback. They aren't going to like it, but you have to be informed and be educated. That's why I love doing these, because it gives people information that they need so that they can go in and advocate for their pets, rather than just saying, yeah, just do whatever you need to do to fix my pet.
Yeah, because it's really not as simple. Here's a pill for all ills. It's right. It's never going to be so simple like that. I did think of one more question before we wrap up, and it goes back to the diet thing. So cats who eat a fresh food diet or raw diet may tend to have, is it an elevated BUN, which is normal in cats who eat fresh food? Can you talk a little bit about that, just so that our pet parents aren't going to freak out when their cat's BUN levels may go up just a little bit?
Yeah, that's a really good point. I forgot to mention that, so I'm glad you brought that up. It'll go up normally just a little bit. So the lab tests, the normals from the lab, are just based on averages, meaning they do a whole bunch of blood tests on what they consider quote unquote normal pets. And then this is what they consider to be the normal ranges. So it's pretty arbitrary. Well, I can almost guarantee you those are going to be kibble fed. They're not going to be raw fed. So the normals can be a little bit different. And yes, the blood urea nitrogen will go up a little bit. Usually not more than like 3 or 4 points out of the normal range, but it'll sometimes set the vets off. I mean, oh, look at this, stage 1 kidney failure, because that BUN is up, even if the creatinine is normal. But normally the creatinine will stay in the normal range, but the BUN will go up because it's urea. Urea is a component in the protein, and particularly in the meat protein. So it will go up just a tiny bit, but it shouldn't, like I said, be more than like 5 points out of the normal range. And it shouldn't be trending up. Like if you see a result like this and it makes you nervous, I mean, you can go back and get it checked again in a couple of months if you want to, and just make sure it's not trending up. And then that's the normal for your kitty.
Right. And I'm glad you said that they usually take those values based on pets who eat processed food diets.
Yeah.
I think it would be interesting for the industry to do a whole new set of diagnostics, like averages on pets who eat fresh food diets, because I think your numbers would be different.
Yeah, I think they would be too. It'll probably never be done, but I think you're spot on. I think it would be very different. Yeah, I think it would be very different. And also remember that these values they're snapshots in time. They're always fluctuating. So a mild elevation, it could be maybe your kitty didn't have a drink for a few hours before it went in, or if you fasted, sometimes vets will recommend fasting before going in. So then they might not have had a drink in a while, because cats, get a lot of their moisture from their food.
Right.
And so if they're even just a little bit dehydrated, that will drive that BUN up. Now they go home and eat and drink and do all their normal stuff, they're going to correct that hydration. But remember that those values are always fluctuating, and they're just a snapshot. So to commit a pet to like a lifetime protocol based on one set of lab work is just completely insane. It's just not good medicine at all. I've when I was in practice, we would sometimes see blocked kitties, especially the male kitties. Female cats don't really block, and if you did blood work on them when they came in blocked, these kidney values would be sky high, because you've got all that pressure building up in there.
Yep.
But you check them 2 weeks later and they're back down to normal. So it's not permanent kidney failure. You can have an acute incident especially in a
Yeah.
young animal. It's really important to think about this. You could have an acute incident. Did they go outside and nibble on a weed that's processed by the kidneys and it raised their kidney values and that just happened to be going in for blood work? You know, if it seems out of the ordinary, especially in a young cat, the first thing I would do is just wait a few weeks and just get them checked again and see if it's just kind of a one-off and if the values come back down. Because to commit, especially a young animal, to lifelong, prescription diets or kidney treatments, when it might have just been a normal fluctuation.
Yeah, I think that's very wise advice. Well, that is awesome information. Is there anything else that you wanted to include or share before we wrap things up? If there's anything else you can think of that we didn't cover?
I think I just want to reiterate, look at your pet, don't get hung up on the diagnosis or the testing. Look at your pet and trust your gut. That's probably the big thing. If your gut's telling you, I think my pet's fine, I'm not sure what's going on with these blood values, then take a step back and get them rechecked. So watch your pet and trust your gut.
I love that advice, especially here, because intuition is important, energy is important, and listening to that little inner voice inside of you that you carry around for a reason. It's to help you, not to scare you. But so many people don't utilize that. And I think the more we use it, it's like a muscle. The better you get at it, and you trust it. So that's very wise words. Well, thank you so much for sharing all this great information, and we hope that you guys watching and listening are enjoying this. And please be sure to share this with your friends, share it on social, like and subscribe to the YouTube channel so we can get this in front of more people. And with that, we will be back next time with another show. So thank you, everyone. Have a great rest of your day. Bye-bye.